child is also not wanting to take phone calls from their friends, not wanting to hang out, socially. Friends are calling and they don't want to respond. Something is not right.
So you're talking about a child really isolating him or herself.
Exactly, exactly. And so when you see a child who's not participating either in the family life or in the social life and falling off the tracks academically, for me, I think the child needs an evaluation. Something is not right.
Okay. Now, when we're looking at children's mental health issues, one of the things that we talked a little bit about earlier was this idea of sadness and maybe fears and changes in mood. But how do we really focus in that there's a problem? Because children have fears, children have changes in moods. I mean, what takes it sort of over the line where we're thinking about a mental health issue?
And again, it goes back to, you have a clustering of all of these symptoms. For example, if you take worries, most kids worry a little bit. We all worry. It's just a normal human experience. And I'll ask the child, do you think you worry more than most kids your age? Because you're trying to make a comparison. And that's not just in its, in a vacuum. There are other things, they're having trouble sleeping, or they're having trouble with appetite or concentration, or they're just not having fun, in things that are normally fun for them. So you start to say, there is something here, and it needs an evaluation to try and figure out, is this a mood disorder? Is it an anxiety disorder? Is it an obsessive compulsive disorder? Or is it just, a little, it doesn't really kind of fulfill all of those criteria, but it's a little more than normal anxiety.
Right.
And then, as grown-ups and as we always find reasons why our kids feel a certain way. You and I always do this.
Sure we do.
Oh, honey, you must be feeling sad because you didn't get a Christmas present you wanted.
Right,
and so somehow we always answer for our kids. And sometimes, we actually miss something that's more serious because we find an answer for how the child may be feeling or behaving or whatever it is.
So we really need to, as parents and caregivers, we need to ask and listen for the answer, not supply the answer to the child.
Exactly.
Because one of the things that, we certainly recognize is that if we have to deal with a child's mental health concern, it also makes us uncomfortable.
Right.
We begin to wonder if we're good parents, if we're good caretakers, have we done something wrong? There's a lot of the old traditional psychodynamic literature that talked about poor parenting as the problem. That's at the root of this thing, and so we become afraid that we're going to be criticized and we haven't done a good job, when we recognize that, as you said earlier, there are real genetic predispositions. Things run in families, mood disorders run in families, mental disorders like physical disorders run in families, and that's nobody's fault.
No, absolutely not. In fact, there's a patient of mine who said, Dr. Joshi, I didn't do anything. My parents didn't do anything. This is something that came to me. I didn't go seeking it. And I thought, that was really a very articulate way to describe this. Just like we have, say, diabetes, or epilepsy, or heart disease. We don't say, this just happened. It's not something you wish for. It's something that came to you, not that you did yourself or your parents did.
Right. The other thing that I think is important is that we also recognize that these genetic predispositions, if you will, these things that are inherited and passed on in the families, also have a way of showing up at times when there may be stressful events in life, there may be changes in life, and so forth. And
I'm glad you mentioned that, because just as any other stress can precipitate, say, ulcerative colitis or a heart attack, so can stressful events. And for children and adolescents, it's really, separation of parents, a move, a different school, going away to college, and I call good stresses and bad stresses. There are good stresses in life too, like getting a promotion, getting married, having a child. These are good stresses, but they make you more vulnerable. And so if you have a predisposition, it kind of brings it to the surface.
Right. But let's talk a little bit about one of the other things that we see a lot in that's a concern in terms of especially adolescents, but even now in younger children, is this idea of substance abuse and how that fits into the scheme of things in terms of mental health concerns.
Well, it's a huge concern for all of us, because we always worry about our kids getting into the wrong peer group, and worrying about. I mean, if you talk to parents, there are two major concerns these days. It's exposure to violence and it's substance use, whether it's alcohol or drugs. And unfortunately, some of the kids, as we were talking earlier, they know something is wrong, but they don't know what it is, and parents perhaps haven't quite kind of figured out what it is either, and the kids want to feel better.
Right.
So they they self-medicate is what I call it, and so they resort to alcohol or they resort to drugs, when in fact they have an underlying mood disorder or anxiety disorder or one of the other internalizing disorders. We all want to feel good.
Yes,
and so what happens is now they have two problems to deal with.
Right.
Not only that they have an underlying mental illness, on top of that they've added more problems by now resorting to alcohol and drugs.
Well, one of the things that we also have been extremely concerned about with not only children and adolescents but also adults is the degree and extent to which substance abuse makes people more impulsive, makes people more likely to do things that if they were not under the influence of these substances they wouldn't do. So that we know, for instance, in terms of completed suicides, that 70% of people that have taken their own life did it under the influence of some substance. We know that domestic violence and abuse, often the perpetrators of those kinds of things are under the influence. And so we also, I think, have to be concerned about adding to the risk of suicide, adding to the risk of violence. Can you talk about that just a little?
Well, I always tell parents to have a depressive disorder, to have substance and alcohol use, and to have access to firearms is a lethal cocktail. It truly is. And not that every child who is suicidal necessarily has an underlying depressive disorder, but every child who has underlying depressive disorder is much more vulnerable to have suicide, and we really need to take it very seriously. And so what happens is, if they resort to alcohol and drugs, their judgment is not.
That's right.
I mean, it's impaired in two ways. It's impaired because of their mood disorder, and then on top of that, it's impaired because of they're under the influence. And so, they're not using all their faculties and their coping skills. It's impaired.
Well, one of the other things that has come up, and it certainly has gotten a lot of press as a sensational kind of thing, but I don't know that there's been as much as I would like to see in terms of a more serious look at this whole issue of teenage suicide and even suicide in children. When I came to Baltimore, right before I relocated here just about 12 years ago, I'm from Philadelphia, and I used to work on their suicide and crisis intervention service. It's a telephone service very much like the one we've set up here, Baltimore Crisis Response. And one of the last calls that I took in that job was from a 10-year-old who called very upset and distraught because her 10-year-old friend had warned every adult that she knew that she was going to kill herself. And this, apparently, warnings had gone on for 2 weeks. And I suppose that no one took them seriously because the child was found hanging by a belt in the closet, had killed herself. And at that point, that was the youngest suicide that I had heard about, of a 10-year-old. And of course, as time has gone on, we've heard more about suicides of younger and younger children.
That's correct.
So it really is, I think, a major concern.
It's a very serious matter, and which is why it's really important that if in fact the child has a treatable disorder, we need to take care of it, so we can avoid them getting so hopeless that they think of ending their lives.
Well, let's step to treatment a little bit because we're familiar with the kind of counseling that happens either individually or in a group. Sometimes families need to get involved in counseling because there are family issues.
Right.
There's divorce, there's separation, there's marital discord. I mean, there's all kinds of things.
Exactly.
And, you know, we're kind of familiar, I think, with this idea of talking things out. But one of the things that folks, I think, need some information about is the idea of children being on psychiatric medication, what the medications can do, what we can expect from them, and what we can't expect from them.
Okay. You know, again, going along with the stigma issue, it's, you know, the parents have come this far. Okay, you know, my child has a mood disorder. And then the next thing you say is, well, you know, the child needs a comprehensive treatment package. And what does that consist of? I believe that the children need to know what they're suffering from, because if they don't, they are poor patients in terms of compliance. Often with mood disorders, there's use of medications. And the way I explain it to parents, because, you know, you'll always get this hesitancy. My goodness, you know, why? That's really bad. It must be really serious. And my usual response is, if I took a throat swab and you had a strep throat, and I said, and I was a pediatrician, and which I used to be. I used to be a pediatrician. And I'm prescribing penicillin, what would your response be? And they'd say, well, you know, my child needs penicillin. And I said, how is this different?
Right.
Because we know there are neurotransmitters in the brain that either don't function well or there's a deficiency, you know, like one of them, the most common one is we call serotonin, and we know how medicines help that.
Right.
And so I actually draw it out for them, that this is what's happening in the brain. You know, it's, and so, because parents will say, will my child get addicted to these medicines?
Right.
And again, not to sound very cocky, I said, does your child ever get addicted to penicillin?
Right.
And so, you know, I'm trying to say this is a medical disorder. It needs to be treated just the way we would any other.
Well, and I think that those are important words for our viewers to hear. Clearly, there are many, many things that we could go on to talk about, but we do have a limitation of time. I certainly thank you for coming in to share your knowledge and expertise with us. I understand that you are leaving Johns Hopkins and you'll be moving on to D.C. as the chair of psychiatry at the Children's National Medical Center, and that if some of our viewers would like to get in touch with you there, that number is area code 202-884-3932. I want to wish you good luck in your work, and because I think we need more folks like you out there helping children and families. And I want to remind our viewing audience that if you or someone you know needs help with a mental health crisis, you can call Baltimore Crisis Response Incorporated at 24 hours a day. Thank you for tuning in, and remember, your mental health matters to us.